All righty. I think we're good now. Good morning. Thank y'all for taking time to join me. We're just going to review some HR issues at the district level. Something we could probably spend all day on if we wanted to, but we're going to try to keep this as close to an hour as possible. And I'll try to make it worth your time. After the webinar, I'm going to send you a link to a Google folder that has the documents that you can see on your screen now. And this is going to help you to manage everything that you need to manage, hopefully. The first thing I want to look at would be the PCS form. And there is a way to go in here, and there's an online PCS form. And that's probably the easiest, but we also have the blank paper one if you still want to do it that way. I'm going to pull up the online form just so you can see that. The PCS form is extremely important. We need it for anyone that is hired, but not contracted or substitutes unless they're long-term substitutes. All employees at all the schools need the PCS form, and it's very important for teachers and administrators. Teacher supply money information is pulled from this. The teacher's experience credit comes from whether they're in the PCS system or not. If this stuff isn't in there, they're not happy. And if they're not happy, they're going to let you know it. And then you're probably not going to be happy. But when you go to this online form, you just follow the information on there, fill it out. There should be a drop-down box for the schools. If you're not on there, let me know. Some of the new schools aren't on there yet, but they will be. I need the full Social Security number. That's one thing that I get sometimes. I just get the last 4 digits. But I can't do anything without the entire number. I need an annual salary. You might have some people that get paid by the hour. Just kind of guesstimate, give me an estimate of what you think they would make in a year's time and put that in that box, because hourly, there's no way to fill that out for me in the system. Okay. If you look down, you see certificate number. If you don't have that, that's fine. Just leave that blank. It's not a mandatory fill-in. If they are certified and I have their social, then their certificate number is going to automatically pull up when I go into PCS. Now here's where we get a little tricky. Days employed. Now, if you have, let's take, for example, a teacher that's a 190-day employee. I mean, some are 210, some are 180, depending on your school, how you do that. If they start work on the very first day of the school year, and you say they're a 190-day employee, you are expecting them to be employed for 190 days. So that's the number you will enter in the days employed section. If they start work 10 days later, then they're going to have 180 days is what you're going to expect them to work that year. Okay. Above that, you'll see the 135 days. That works the same way. If they start the first day of school, you are going to expect them to be there through the 135th day count. So you would enter 135. If they start 10 days later, they will only be there for 125 days of the 135-day count. Okay. Position number, there is a code. I'm going to pull up the codes for you. That's also going to be on the link I'm going to send you that tells the different position codes for the different functions. For example, a regular classroom teacher is going to be a 08. Kindergarten's 05. Special ed, you've got 2 categories, one's 06 and one's 07. A principal is an 01. Assistant principal is an 02. But there are a lot of codes. There's a special code for a reading coach. This list also shows you which codes are going to be eligible for teacher supply money, national board certification money, and things like that. So you can see that when we pull that up. If you don't know, you might have something really weird, a weird name for a position that's not exactly spelled out in the position code list. Just type in the title, and we'll figure it out when the time comes. We'll find some kind of code to stick them in. And they may work more than one position. You might have an assistant teacher a teacher that is also an assistant principal. So there's two places to enter position codes. You might have them as a teacher, an 08, for half a day, which would be an FTE, which is full-time employee. If they work a half a day as a teacher, their FTE is going to be a 0.5. And if they also work a half a day as an assistant principal, position 2 would be a 0.2 and the FTE a 0.5, so you'd have a total of 1.0 because they would be a full-time employee. If you've got a part-time teacher, position code might be 08, and if they work a half a day, their FTE would only be a 0.5, and that would be the total of their FTE would be a 0.5. Am I making sense so far? Okay. I didn't mention one thing when I talked about the annual salary. That is also something that needs to be adjusted. If you hire somebody, say 10 days late, their annual salary you're saying is $40,000 a year, they are going to make 10 days less than the $40,000, chances are. So the salary should reflect the number of days they are going to work versus what you would tell them their annual salary would be. Alrighty. If someone is leaving, this form's really important as well. This is how I keep up with insurance, for one thing. I need a termination date, but I also need to know when the last day that person's going to be paid is. They may have left May 25th, but they might be getting paid through June. If they're getting paid through June and their insurance premiums are being deducted in that June paycheck, then their insurance should last through June. If I just get the date May 25th, then to me that means that their insurance should stop May 31st. But that's why I need to know if they are going to be paid later than that so that I know when to either terminate, transfer, or whatever we're going to do with their insurance. Where I need big help here, when somebody is leaving, they don't always like to tell you the whys or the wheres or whatever. If you can try to talk to them and, I guess they think you're going to be mad at them because they're leaving. But try to find out if they are transferring to another school district or another state entity. It is a whole lot easier to go on and transfer their benefits right away rather than find out later after we've terminated them that they really went someplace else, and then we've got to reinstate them and then transfer them. So it's a lot more work. One thing to talk about with transfers are that if you have an employee that leaves at the end of the school year, they're going to another district, chances are their insurance is not going to be effective with the other district until September 1st. Most districts start their employees in August, and that means that the effective date for insurance would be September 1st. We need to cover these people through the summer, even if they're not getting paid. However, you can bill them for the months that they aren't getting paid, or if you know ahead of time, then you can go on and start taking it out of their last few checks. Because, like I said, they have to be covered, and chances are if you bill them, you may not get the money back, and it's not worth trying to go to court over. You're going to spend a lot more trying to get a few dollars than you'll get if they pay the bill. Are there any questions about that?
Paula, this is Noel at Greenville Tech Charter. Hey.
Hey.
I did have a question. I'm going to have questions, so I won't take up the whole call. But the termination date. So if I have a teacher that's leaving to go do some mission work, is where they're actually going. Our last day of school, I guess for teachers, is Friday the 26th, somewhere around there. But So do I put that for the termination date? But then his last pay period, he'll get paid through the end of July. So where do I indicate that?
There's a box near the bottom that says additional information. There are a couple boxes.
So I just put it in there. Okay, I didn't know if there was another calendar field.
Yeah, you can just type it in there. That'd be great.
That's perfect. Thank you.
Okay. All righty, sure. You will also notice up here, this is a fairly new item that we've put in. It's due to Regulation 43.58.1. If an employee is dismissed, this is really for teachers, because of some kind of misconduct. We need to know that because we're supposed to report it to the Department of Education's Office of Educator Services. They need to know that what these teachers are doing if there's something bad. So check yes or no, and then we can discuss that later. But that way I know whether to contact you to find out what is going on, what the situation is. Okay. All righty. When you turn in the termination forms, like I say, do that as soon as you know someone's leaving. And the reason for that is if I don't know they're gone, I can't do anything with their insurance. That means that you are going to keep paying for their premiums and the part that you pay yourself. It's been 6 months or more at a time when somebody finally says, oh, hey, they left. Well, guess what? There's no refunds. You paid for their insurance for those 6 months, even though they weren't an employee. And there's nothing we can do about it. People will not give us back the money. Let's see. I'm going to pull up the codes just so you can see them. They're on this sheet. So if you click on PCS position codes, you'll get this form. And this is where it shows you the different position codes for the different positions, obviously. This tells you whether they're eligible to receive teacher supply money, the National Board Certified money, whether they are, whether they have to go through a DEPT, technology proficiency, all those types of things. What you want to think about with this is if you do have a teacher that is also, for example, an assistant principal, if you don't list the teacher part first, they're not going to get the teacher supply money. So somebody mute, please. I don't know what that is. Okay. Trying to figure out how to mute.
Hey, Paula, I think it's Dana Anderson.
Okay.
There you go.
All righty. Thank you. Okay. All righty. Like I say, if you've got say, for example, somebody working in two positions, but if part of the position is as a teacher, make sure you list that one first. That is going to be what they consider the primary position, and that's where they're going to pull the teacher supply money. So if you want them to get that supply money, even though they're also an assistant principal, put teacher and then put assistant principal on the form. Okay, and as you can see, there's several pages. So there's a lot of different codes. But if you have any questions, just holler. All right. If you have changes to things like position codes or FTE time, I need a new PCS form. If one or two people have a salary change, then go on and submit a new PCS form. However, almost everybody has salary changes for the entire staff at the beginning of the school year. In September, I will ask everybody for a list of their employees because I have to do salary updates for insurance purposes and in the PCS system. So all I'm going to need at that point is just a list of everybody and all the new salaries. There's no reason to fill out a new PCS form for everybody. for the salary changes, if they're across the board. So that'll save both of us some time. There's something else on this form, on here, the HR checklist. This is something that will grow probably, but these are things that I thought of that you might want to look at just to make sure that you have everything when you do hire somebody that is needed at the district level. Okay, it says the PCS form. Of course, that's important. If you happen to know if the teacher has national board certification, let me know that. We need to start paying them as soon as possible for that. With insurance, I'm going to need a notice of election form. If they're getting health insurance, tobacco certification form, marriage license, birth certificates, all that stuff. We're going to go over that here in a few minutes. But this list will just help you keep track of everything that you need. Another thing that all the schools tend to deal with is the Family Medical Leave Act, FMLA. There is a link to the FMLA webpage, and this tells you pretty much everything you need to know. If you have an employee that has been working for you for at least 12 months, they're eligible for FMLA if they meet certain criteria. They can have up to 12 work weeks of leave in a 12-month period due to the things that are listed here. They can also have leave if they're taking care of a spouse or a close family relative. And some of the schools just kind of keep up with this themselves with the time and everything. But there are also forms on this webpage that you can go to. And if you want to use the forms, they're down here. You can just access the FMLA forms, and you can give it to the employee and have them give it to their doctor to fill out if you need the proof that something's wrong. Obviously, chances are if someone's pregnant, then you can probably pretty much tell that. But if you're going to start using the forms for one person, you need to use them for everybody. But that's totally up to y'all how you want to keep up with that. This is a school thing. So, but I just wanted you to know where to find the information for that. Now we're going to go to insurance. If I've got some schools on here that might not have the state insurance, this will be probably boring to you, or you might learn something, or you can drop off whatever you want to do. I can't get to it from here. Okay. There's a great website, the PIBA website, and it will give you everything that you need for insurance. It'll tell you a whole lot of stuff. Let's see if I can get to that. That's not it. Come on, quit. Okay, here we go. There's a link to that on that Human Resources page that I'm going to send you as well. You can do most everything online now, if you've got the right web browser. I can only fill in the forms online if I'm in Mozilla, Firefox, or Foxfire, whatever it's called. But some of you might be able to just pull them up. Okay, if you go to Insurance Benefits, click on that. You'll see all the information that you really would ever need for insurance. Every full-time employee, which means that they work 30 hours or more, has to be offered insurance. And every teacher that works at least 15 hours a week or more has to be offered insurance. There are two different notice of election forms, regardless of whether they want anything or not. Everybody must fill out a notice of election form. They can just check refused if they don't want anything on all the boxes. And we'll go over the forms real quick. For the health plan, first you're going to go to forms to get those. Then notice of election. The active notice of election is for your full-time employees, 30 hours or more. They have to fill out everything that you see on right here, the new hire or transfer or a change. And we'll go over what the differences are with that. New hire is somebody that has not been in the PIVA system, at least not for a while. And it's a brand new person that you're hiring. The next thing they fill out is whether or not they want money plus pre-tax premiums. This confuses a lot of people. They see the money plus and they think that means, do I want a medical spending account or something like that. All this means is that their premiums are going to be pre-taxed. So if they choose yes, there is a 28-cent a month fee, an administrative fee, to do that. But when they have their taxes done, the premium part is going to come out before they're taxed. So, for example, if they made $10,000 a year and they paid $1,000 for premiums, they would only pay taxes on $9,000 for that year. Or they can refuse it and, not have to worry about it. Everything's taxed. They need to fill out 1 through 19. 18 and 19 are some that are left off a lot. And I have to have that in there. I have to have the annual salary and the date of hire. County code, if you don't know the code for the county that they live in, just type the name. That's fine, or print it, if you're just going to print the form off. If they are trying to cover anybody that is on Medicare, they should list them in 20, but chances are they're not going to want to cover somebody that already has coverage in Medicare, so that's usually not anything that gets filled out. Boxes 21 through 28 have to have some kind of mark on them. If they're refusing all coverage, they just check the refuse box. Sorry? Please? Okay. Just check the refuse box in each one, but each one has to have something. Now, I know, if you're single, you're not going to have a life spouse, but you still have to have the refuse box checked, okay, or they're not going to accept it. Any employee that is on TRICARE could get the supplemental TRICARE insurance, but most of your employees are going to be picking either the standard or the savings or refused. So one of these boxes has to be checked, and then one of these, unless they're refusing at all. And like I say, everything else has to have a check in it in some way, shape, or form. If they are getting health insurance, they are going to have a $3,000 basic life insurance policy. That just comes with the health insurance. The employer pays for that. So they need to check basic life and fill out information for a beneficiary. They need a primary, but they can also choose a contingent beneficiary if they want to. If they chose optional life, they also have to have a beneficiary for optional life. It can be the same person, so they can check both boxes. Now, with optional life, if you have a new employee, they may get up to 3 times their salary in increments of $10,000. So if you have an employee that makes $33,000 a year, they can get up to $90,000 worth of optional life insurance. You can't go over. So 3 times would be 99. Excuse me. But since you can't go over, they have to choose the 90,000. Okay. Now, if someone is refusing all coverage and they are married, they must list their spouse's information down here in the dependent section. You would not put anything in this first column because you're not adding or deleting. You're just listing the information. You put their social security number here, and this gets missed a lot too because that's kind of tiny, and these spaces are kind of tiny, so people don't see that that's what that is. But the social goes here, and name, relationship, date of birth. If their spouse is on PIVA insurance, they would check yes. If they're not, they'd check no. What PIVA needs to do is make sure that a spouse is not covering them. If they're trying to refuse coverage because they say their spouse is covering them already, if their spouse is covering them on PIVA insurance, they can't do that. You have to have your own insurance if you are eligible for the PIBA coverage. So if a spouse is covering another spouse, then he or she has to drop that spouse so they can get their own. Okay. Another thing, excuse me, if you are adding children to any kind of coverage, you would put the A here for add, the child's social security number, the name, sex, and this is what's crazy. You would put sex, male or female, but then you cannot put child under relationship. You have to put son or daughter. Obviously, if it's a male, it's going to be a son, but they'll reject it. So that has to be in there. This part with full-time student, that is for kids that are in college. And incapacitated, obviously, is for incapacitated children, because they can go over a certain age if they're in college or incapacitated. Anybody have any questions about the notice of election form? Okay. Come on, computer. There is a separate part-time teacher's notice of election form. They can only get the health, dental plus, and vision. They don't have the options for supplemental long-term disability or optional life insurance or dependent life insurance. But they do have to fill out one of these forms saying whether or not they want insurance. It's basically the same thing. You just fill out the same things that you did before and just make sure that they do enter all the information. If they're married, even if they're refusing everything, you need the spouse's information on there too. Now, when they are covering either full-time or part-time teachers, if they are covering a spouse, you need a copy of the marriage certificate or the first page of their most recent federal tax form. They can scratch through all the financial information, but there has to be some kind of proof that they are married. If they are covering their children, you need the long form birth certificate for each child. Little cards that South Carolina used to give out will not work. The document has to have the parents' names on there to prove that they are children of this person. Or if they're adopted, you need the decree for that, or if they are being covered due to a divorce situation and you're the one that has to cover that child, you need the decree to show that. Any kind of legal document for that purpose. One thing you want to look at are the premiums for the part-time teachers. They are high. They're lower for you, but they're higher for the teacher. And it depends on how many hours they work. And I'm trying to get that form to come up. There we go. That's under resources. Permanent part-time teachers. If they work 15 to 19 hours, this is what they'll pay for whatever they're getting, and this is what you're going to pay. Your part's less, their part's more. If they work 20 to 24 hours, their premiums go down a little bit and yours go up. And then if they're 25 to 29 hours, their premiums go down even more and yours go up some more. Just make sure that when you do hire somebody, that you get them to fill out that notice of election form if they are full-time employee or part-time teacher working at least 15 hours, and send those to me. Now, the effective date is determined by whatever date they start working. If they start, say the 3rd of a month, then it's going to be effective the first of the next month, unless the third of the month is the first working day of that month. Then they can go on and sign up. So, for example, if they were going to start work August 3rd happened to be a Monday, then they could actually start their benefits August 1st or pick for September 1st, because the third would be the first working day of that month. That's going to be up to them, so you need to ask them which one they want. Now, technically, if they start the actual first, say August 1st, their benefits are supposed to start August 1st. We have been allowed to get away with saying September 1st because sometimes we don't get the paperwork in until August 28th, and there's already been a whole month, and they don't want to pay for that month since they really haven't had a chance to use it. So we have been able to kind of fudge a little bit on that, and they've been letting us. But like I say, technically it's supposed to start the first of the month when they do start on the 1st. Okay, we talked about we need marriage certificates and birth certificates. If they are getting health insurance, we also need the tobacco certification form. They have to tell us whether or not they use tobacco products, and if they do, if they are getting coverage just for themselves, there's an additional $40 a month tacked onto their premium. If they are also getting insurance on somebody else, even if it's just a baby, it goes up to $60 more a month. If they don't use tobacco products, they check the first box, sign it, and send it in. If they do, they check the third box, sign it, and send it in. If they stop using tobacco products for at least 6 months, they can send in a new form, send it to me, check the second box saying that they've quit, and this does say that I certify that I completed the Quit for Life smoking cessation program, but I called about that, and PBA said, well, just as long as they quit. So we don't really have to have any kind of proof that they did that. We can just say that they quit, and they will remove the extra premium at that time. Okay. Also in the PBA system under insurance is a place called My Benefits. This is something you really want to show to your employees. If they go in here and register, what they will need is their benefits ID number that's on their health insurance card, and just name and ID. They'll know, just register, fill it out. They'll get everything that they need right here, and then they can set up an account. When they do this, they can go in and log in. They can make changes at any time themselves to their address, their beneficiary. During open enrollment, they can make their allowable open enrollment changes online, and you don't have to worry about any paperwork. Everything comes to me through an email. Done deal, easy. And that's the way you really want to try to get your folks going, is by getting them on that My Benefits. They can also look at any time to see what coverage they have. They may not remember whether they have $100,000 of life insurance or they have $50,000. They can look for themselves. It saves you a lot of time and me a lot of time. Now, during open enrollment, of course, we can make certain changes. Depends on what year it is. This year, we haven't gotten any word out yet, but we should be able, we will be able to make dental changes. Every odd year we can make dental changes. You can change whatever kind of coverage you have. You can add coverage. You can drop coverage. One thing we don't know about is SLTD and the optional life, whether or not they'll let us make changes to those yet, but we'll find that out probably by August anyway. And I'll send you information on that when it happens. Now, other times that you can make changes to your insurance are during special eligibility situations, like marriage, a legal separation, divorce, adding children, newborns or adoptions, dropping a spouse or child. If you gain other coverage or lose other coverage, you can make changes at that time, but you have to do it within 31 days from the date that whatever it was that happened happened. Okay. You may get, and you probably will, get a lot of transfers into the schools this year from other school districts. These are really pretty easy. We should not have to fill out a notice of election form. What we need to do is when you hire somebody, ask them, are you coming from another school district? If they are, we need to tell them to immediately contact the benefits administrator from that school district and tell them to transfer the person to our group, and our group number is 5400500, and give them the effective date for the transfer. And here again, the effective date's the same, set up the same way that we talked about earlier. If they're going to start the 15th of August, the effective date's going to be September 1st. If they're going to start August 1st, the effective date's August 1st. But that person needs to be able to tell their benefits administrator, transfer me to 5400500, effective whatever. The benefits administrator there will then go in the system, hit the transfer, type in the codes that they need and the date. That will generate a form to me for them to sign. And it already has all of their information on it. They cannot change insurance anyway. But they, sorry, I just got a message. I was reading that too, trying to do two things at one time, and I'm not very good at that. So they can't make any changes to their coverage when they do transfer. So it's going to have to, stay the same. The only thing they can change are their address and things like that. I'm trying to see how to get to my messages. People were sending me some messages to answer some questions, and I'm not real sure how to get there. This is my first time doing this, y'all, so I'm sorry. Bear with me a little bit. If anybody knows how to do that, let me, chat. I bet that's where it is. Okay. I have a message asking if individuals are able to print proof of insurance coverage through the link. I'm assuming they're talking about My Benefits. Yes, they should be able to do that. Can you review payment of benefits through the summer when they are transferring? I don't recall if the old school pays through the summer, if we can deduct from their pay. Okay, yeah, I think you missed that part earlier, I believe. Yes. If they are not getting paid through the summer and they are transferring to someone else effective September 1st, you may collect their premiums for the months they're not getting paid ahead of time if you know that they are transferring, or you can bill them. Okay, I also have a question about contracts. If a contract starts, say, August 1st, but the actual date of attendance is August 9th, the date of they start work is August 9th. So technically, unless you're, this one gets kind of tricky because some of the payroll systems are set up that they start paying in August, and some are set up that they start paying in July, and some are set up that they start paying in September. If your payroll starts for these teachers in August, is effective August 1st, go on and put the August 1st as their start date, and their transfer date will be August 1st. If nothing starts, if they're not going to get paid in August, then put August 9th, and it'll be effective September 1st. Does that make sense? Okay, we just want to make sure that they're not getting premiums taken out from two different places at one time. So if you have any questions, just holler at me. Okay, anyway, when I receive the transfer form, I will send it to you and get them to sign it and send it back to me. Hopefully I will get those before we have any kind of lapse. But even if there is a couple of days lapse between when theirs ended and we get the forms filled out for ours to start, it's still going to start effective the day that the other one stops. So there's not going to actually be a lapse of coverage. It just may not be in the system totally all at the same time. That's another reason that PCS forms are important. If I don't have a PCS form on the person, I'm not going to know where to send this form when I get the transfer form. I'm not going to know what school to send it to. So what I do when I get those forms, if I don't know, then I go looking through the PCS forms to find out what school that has hired that person. So the sooner you can send the PCS forms, the better. I've got a message from Gretch. Okay. If you are a school transferring in and you have, a ton of PCS forms, you can send me, if you have a spreadsheet with all that information on it to initially get you started, just do that. Don't worry about sending in a separate PCS form for each person. Okay? That'll work as long as I have all the information on that spreadsheet. Then I can use that versus filling out a new form for everybody. And after that point, once we get them in the system, then changes or terminations we'll need a form for. Okay, if you've got teachers that are transferring out of the district, it's real important, I've already mentioned this earlier, to find out if they're going somewhere else and to let me know as soon as possible. That way I can help their new school district by having everything done for them. And we aren't caught up in the termination and then reinstating and then terminating. It also makes it hard to get their pay, their premiums for the months that they aren't getting paid. So you want to just try to find out and let me know just as soon as you can. There's one thing that I did not show you, and I need to. When you are enrolling somebody in insurance, filling out the notice of election form, y'all may be doing this and you may not, but you should be. According to the Affordable Care Act, there is a letter that each person should receive called the Marketplace Letter. This letter should go to everyone. It's called Marketplace Exchange Notice, and it's under the Affordable Care Act in the PIVA system. If you pull that letter up, it tells you pretty much what you need to do. You need to fill this out, the red spots, anything red you need to fill in. The BA's name and number, that would be me. You fill that part in. Fill in Part B, all the employer information. PIVA has filled out everything else, so you don't have to worry about what to check or anything. In this section here, just leave it blank. You don't need anything in there right now. Print this form, give it to the employee, and what I do is I take that top sheet and I make them sign it saying that it's received, and I put that in their file. They can have the letter, and you've got something signed to prove that you gave it to them. Okay, and that is an Affordable Care Act policy that you're supposed to give that to everybody. Okay, one other thing we need to go over would be Money Plus. That can be very confusing. You've got the health savings plan, you've got the medical spending account, you've got the limited medical spending account, you've got the dependent care spending account. When someone first enrolls in insurance, usually, this is going to be August, September, y'all are working on these, they cannot at that point get a medical spending account or a dependent care account. Those are calendar years. They can sign up for those during open enrollment. However, if they get a health savings account, they can do that if they get the health savings plan for insurance. That's the only way they can get a health savings account, is if they have the health savings plan. If they have a standard plan in open enrollment, they can sign up for the medical spending account or the dependent care account. That's the difference. the health savings plan goes with the savings plan. They have to open a bank account, and the money that they put in will go out of their check and into that account to save for medical spending purposes. These are all pre-taxed accounts. They can only put in so much a year. If you pull up the Money Plus enrollment form, it tells you what the maximums are. If they're getting a new account, the most they can put in for a year, it depends on how many people are, if they've got individual, $3,400, family, $6,750. If they get this, if they have a savings plan, they get a health savings account, in October during open enrollment, they can also, if they want to, sign up for a limited use medical spending account. Those are for people on the savings plan only. That's an additional account to pay for things like dental and vision expenses. And what that is, that'll take out extra money and put it into an account that they use to make those payments. It is a use it or lose it type thing. The health savings account, on the other hand, is something that will just continue to grow over the years if they don't use it. If they have the standard plan, they can get either a medical spending account or a dependent care spending account, but only enrolling in October to be effective January 1st, because it does go through a calendar year because of the tax purposes. The medical spending account and dependent care spending accounts are use it or lose it accounts. If someone's going to sign up for a medical spending account, they need to make sure they are going to spend that much money that year, or it's gone. What they would do is they fill out an enrollment form, send that in to me. They will get a debit card that they can use for their medical spending. If they're going to put in $1,000 over the course of that year, January 1st, they're going to have $1,000 in that account. They can go on and spend the whole $1,000 in January if they need to, but they're going to be essentially paying it back every month through the rest of the year. If they want one of these, every year they have to re-enroll. This is not something that continues. It's a one-year deal. So if they want it again in October, they're going to have to re-enroll. Same with the dependent care spending account. Now, what's a little bit different about that than the medical spending account is that the money is not fronted. The dependent care spending account, they cannot use until the money is actually in the system. So they're going to have to wait until the end of the month or the middle of the next month for their money to show up, their deposit, before they can actually use it for dependent care spending. Now, there's probably still going to be a lot of questions about this, but you can find all sorts of information about it here on PIVA's site. If you go to resources, eventually it'll come up. And you can find a lot more about, there's publications on it. You'll find the insurance benefits guide. They don't print that anymore. So this is something that you want to make your employees aware of. They can go to this insurance benefits guide and get all the information on the different plans. Here's some summaries of the different plans. There's stuff about Money Plus down here. There's all sorts of information. This is just a valuable resource for anybody that's doing anything with insurance. Another place you want to go to are the presentations. If I come to your school, and you've got a lot of new employees, and I'm coming to your school to talk to them about insurance all at once, this is what I'm doing. So, you can do it yourself. I'm going to go through the insurance orientation, pull up the PowerPoint, and go through everything. It explains all the different kinds of insurance that they can have. It gets into the weeds with the different accounts, the standard, the savings, TRICARE. You don't have to go through absolutely everything on here, but this will be good for you to use to go over with employees, especially new ones. If you've got, especially if you've got a bunch of them all at one time, that they can hear everything at the same time. You can find your monthly premiums here, all your forms. I mean, it's just, like I say, this is a real valuable tool to use. Okay. Here's another thing that a lot of people just don't know about it because they just don't think about it. The health and wellness. We have some perks that people just don't even realize. And things are listed here that you can talk to them about. PIVA perks, we've got, if this thing will open. These are different things that are paid for by our insurance, but people just need to be aware that they can get a free colorectal cancer screening. Maternity management, that's coming soon. And mothers now can get breast pumps for free. It's a certain one, but they can still get it for free. They just got to go in here and sign up for everything. Flu vaccines are free. The tobacco cessation program, stress management program, who needs that? Weight management program, I need that. But there's and all this stuff's just free. They just need to know about it, and they can find a lot of stuff right here if they're better at the computer than I am. There's also a way to get free medications if you have diabetes or high blood pressure. So they just need to search around here and find these things. One other place you need to make them aware of is SouthCarolinaBlues.com. They go in here and sign on, get their health toolkit is what they call it. You register, enter your information, then you get a log on. You can go here and you can find doctors, dentists, hospitals, anything like that. There's also member perks here. There's member discounts for things that, here again, people just don't know about. Hair restoration, hearing and vision aids, fitness and wellness. And these are things that we get pretty good discounts on just because we are in the PIVA system. There's also Blue Care on Demand. Trying to find it here. This is something fairly new. It just started this year. Here it is. You can actually call and get face-to-face on your phone or your computer with a doctor. And instead of going to the doctor's office, it's $59 for the office visit. And the doctor, if it's something like the flu or sinus infection, conjunctivitis, things like that, and you don't feel like going to the doctor or you don't have time to go to the doctor, you can log on here and actually see a doctor over the phone, and the doctor will send you a prescription. And what you do, you go here first and log on. You get a log on and you enter your insurance card information, but also your debit or credit card information, so that they just deduct it after they connect you with the doctor. If the doctor can't help you, then they reimburse you. If the doctor says, no, you're going to have to go in someplace, then you get your money back. But that's a pretty cool thing. So just make everybody aware that these things are here and, easy to use and good to know about. Does anybody have any questions about anything we went over? Y'all are awful quiet. Is everybody there? I feel like I'm all alone.
You're not
We're
alone.
listening.
Yes, this is being recorded, so this should be available to watch again. Okay? Alrighty, y'all know how to get in touch with me if you need me. Have a great day.
Thank you.
You're welcome. Thank you.